The content of this podcast is for informational and educational purposes only. It is not a substitute for professional therapy or mental health services. If you are experiencing emotional distress or need support, please consult a licensed mental health professional.
Episode 2 of Trauma Unpacked, Childhood Trauma, with clinical psychologist Deborah Olushala and educational psychologist Melina Giorgio.
Welcome to Conversations on the Couch, Safe and Sound. My name is Deborah Olushala, clinical psychologist at the Couch, and today we have a beautiful, amazing guest. Her name is Melina Giorgio, and she's an educational psychologist also at the Couch. Welcome.
Thank you very much for having me, Deborah.
How are you doing today?
Good. Excited to be here with you guys.
Oh, we're excited to have you. Thank you for making the time, the effort, the space, you name it. We're so grateful. I guess I'm going to go straight into it. Today we're talking about childhood traumas. I think for me that is a topic that a lot of people struggle with, for obvious reasons. But I feel like we need to bring it out there to the public so that people can reflect and, hopefully get the help that they need through therapy and, other modalities. But as you know, I was preparing for this podcast. I was watching the Menendez Netflix documentary and also reading a bit on Google about them just to, really understand how did they get to the point that they got to, did what they did. And, some of the articles that I had read spoke about the fact that they had been severely traumatized by their parents, primary caregivers. So they had gone through a lot extensively. And I think it's also come out in the court case. And it's horrific. It's gained a lot of media attention. But the fact that they went through these excruciating ordeals affected who they are as individuals. And I guess today we want to try and understand childhood traumas, hopefully on a much deeper level. And maybe you can take us through, what is childhood trauma? How can people understand what it is?
Yes, I'm also actually following that documentary at the moment. Haven't quite finished it, but I do find it quite fascinating. But yeah, what is childhood trauma? Essentially, it would be any negative experience or event that a child has undergone that has shifted their developmental or a sense of self. And I think what people don't realize about childhood trauma or any trauma actually is that it actually has it shifts the way that we think. It shifts the brain structure.
I like what you said in terms of it shifts their development and their sense of self. And often people don't realize that a change happened at a particular point when they experienced that trauma, and it's led to different patterns of behavior, different emotional reactions, psychological reactions, and I guess also their social interactions. And I'm aware that there are, different types of childhood traumas, and maybe you can take us through some of them. What did they entail, maybe, just so that people can have an idea of. Sometimes, I realize, being a psychologist, people minimize their traumas. They think that it's significant, it happened so long ago, but it's still impactful. So please, can you take us through what are the different types of childhood traumas that one may go through?
Yeah, I think what we need to hold in mind is that as individuals, we are only a sum of our experiences. So everything that we have gone through in life has had an implication on how we understand ourselves and the world around us. So yes, it's so significant to actually think a little bit around what we have gone through. So some of the childhood traumas would possibly be sexual, physical, emotional, and verbal abuse, neglect, bullying, medical traumas, which would be any severe illnesses, any hospitalizations, deaths and loss in around or of significant others. Those are the kind of things that would constitute as trauma, I would say.
Yeah. When you spoke about the medical traumas, it took me back to, I used to work in the cancer ward there in Pretoria during my as the internship. And honestly speaking, it was so emotionally overwhelming that, these children have to come in and out of the hospital. And every time they come, and if they were my previous patients, they would call me, but they were so anxious. because coming there means that they're going to go through a lot of tests and, being treated, having to see so many medical practitioners. So that really affected them quite a bit. And sometimes, it's difficult to watch a child go through that, and the impact, when they, make it through, the impact it has on their psyche as they grow up. It's still, it's long lasting, sometimes. But thank you for sharing that. I mean, all these different types of childhood traumas, no matter how big or small it may have been, still has an impact on how a person functions, how they develop, and how they, develop their sense of self. But now, um, these children become adults, right? And not everyone has had an opportunity to deal with their childhood traumas. And I think going back to the Menendez brothers, I don't think they got the help that they needed. I don't think they got to see a psychiatrist until, they had done what they did to their parents. And I'm always wondering, like, if they had received help much better, would that have, you know, helped them? If they had received the support and the counseling, how it would have created a shift for them. And we still find that adults struggle to talk about childhood trauma. I mean, I sit sometimes with clients and they come with one particular problem, maybe work related or relationship related. And the conversation or the dialogue often goes back into their past, into their childhood. And sometimes when we reach that door, a lot of them don't want to open that door. They're so afraid, or they don't see the point of it. So, from your professional experience, why do you think that some adults struggle to talk about their childhood traumas?
Yeah, look, I think it's a very daunting thing to think about. I mean,
Yeah.
if I have to think myself, let's go back and unpack all the experiences you've been through. It seems quite overwhelming to think that. But there's a lot of different reasons as to why not. One of the reasons could be that people have actually detached from those memories, have actually boxed them, like put them away, and don't want to access them or actually struggle to access them. It's they've actually created such a detachment from it that that it's quite challenging to go back there, and it's a defense mechanism. It's something that the mind does to protect oneself. Other reasons might be stigma, mental health stigma. It might be family or cultural norms as well that would limit them from actually having these conversations. It might be that they feel guilt or shame around their experiences. Also, that they are just concerned about that vulnerability and experiencing or having those experiences brought to the surface again. It's quite an overwhelming thought, I think, to relive some of the traumas that people have gone through.
No, yeah.
So, yeah, I would think those are some of the things maybe that contribute to that resistance.
I think you hit the nail. Often these are some of the responses that we do get in the therapeutic space, where people aren't necessarily ready. They're not ready to access those kind of memories that will trigger certain feelings and emotions, especially at a time or a space where they didn't have tools, they didn't have the knowledge, they didn't have the safety, net that they could lean on to protect them from these different types of traumas. So it's quite difficult, and it's like a Pandora's box. You open it, you're not really sure what you're going to see, and many people are so afraid that it's going to destabilize where they are right now. But they also don't realize that sometimes not talking about it or dealing with it is actually causing uh, um, them being dysregulated or even destabilized in their current predicament. But thank you for bringing that to light. I mean, just to really understand the different reasons as to why people will not be able to either access those memories or wanting to access those memories. But I've heard about, not that I've heard about, but we use DBT, sometimes in our therapeutic space, and it's been known to also help those with trauma. But there are people who don't necessarily know what DBT is. So, just for context sake, maybe you can tell our viewers and listeners, what is DBT?
So, DBT is dialectical behavior therapy, and it focuses a little bit around our emotional regulation, distress tolerance skills, interpersonal skills, and also mindfulness. I guess the reason that it could be applicable for trauma would be that it does work a lot with those impulsive behaviors. It can very much create a sense of awareness around oneself, being more mindful around what our triggers are, where they come from. So, in that way, understanding ourselves a bit better would access a little bit of that trauma and also help while accessing that trauma, I think, or really understanding ourselves a bit better, not just our traumas. Really, I guess, what's the right word? Assisting them in regulating those emotions a bit better. Regulating their emotions a bit better, more effective coping mechanisms to navigate through specific experiences of distress.
Yeah.
Yeah.
Okay. Yeah, and I think those pillars of DBT is quite helpful, you know. So, how does it work though in DBT? You know, is it a step-by-step process, or you know, how do you engage people in DBT when they do come for therapy?
Just to be clear as well, DBT is not particularly a trauma specific therapy.
Yeah.
So, just so that everybody is aware of that, it's just a modality that can be used to assist with such things. I mean, I think, and combined with specific trauma informed therapies, it would be a lot more successful. But DBT within itself, how you would engage it, it is very structured in nature. It's a structured approach. There are specific ways that you go about engaging a client, and it's also very practical in nature, which is why I think I enjoy working with it so much, because it does provide practical skills to individuals in terms of how to become a little bit more self-aware, how to maybe take ourselves a little bit deeper into our experiences, into understanding ourselves. So I think that's quite nice, because a lot of therapies, we sit and we have conversations and discussions, and in that space, it makes a lot of sense and things connect for clients. But a lot of the times, as they leave that space, they kind of unsure how to navigate what they've just experienced or spoken about and apply it into everyday living. So I think that's what I enjoy and connect with the most around DBT, is that it gives individuals that opportunity to possibly, or guides them into what they can do as they leave that space. This is what you can focus on. This is what you need to look into a little bit deeper. So yeah, I think that's what I like about it, that practical end.
And I think that's what sometimes people do look for, those who are open to therapy and dealing with their traumas. But I can talk about it, but what must I do? How does it help me? You know, so I think it's really good that DBT offers those practical, you know, exercises and activities. Could you possibly share an example, you know, either with the distress tolerance or the mindfulness or the interpersonal skills? Like, for example, what could one possibly do, you know, outside of, you know, the realm of therapy to be able to help them cope with their traumas?
Look, I guess that's a very broad question. So it's not so easy to kind of put into practice, because everybody's experiences are so different.
Yeah.
Each individual is so different. So what works for one doesn't always work for somebody else.
Yes.
But I mean, some examples, if we're drawing from distress tolerance skills, which means that when I'm in a space of feeling quite overwhelmed, what is it that I can do to help ground me again? Effective coping mechanisms. So some of those would maybe be some breathing exercises. Focusing deep breaths in through the stomach, you know, like, well, not in through the stomach, but taking a deep breath from the stomach,
Yes.
And exhaling, like focusing so on our breathing. They could use distraction techniques, such as having a conversation with a friend or a loved one, or someone that they feel supported by and trust. They could maybe use gaming even, as a way to kind of distract themselves from that overwhelming sense of emotion. Self-soothing techniques. You could possibly, if you enjoy baths, you can have a beautiful candlelit bath, maybe some salts in your bath, bubble bath. Just having that moment it could be very soothing for individuals. There's so many different practical elements that people could engage in, and like I say, some work for some not for others. So it's very much around tailoring it to each individual.
Yes. Is there also an element of trial and error, you know, in terms of these practical skills that you equip them with?
Look, it's very much a conversation with your client as well, trying to understand your client, what the individual connects with, what they enjoy, what they believe in, or what they hold value in, and working very much with what they hold value in. I think, and so drawing a lot from that. So when you get to know someone, you kind of get a sense of what they would enjoy and what not, and also to have that conversation. Like, here's some ideas around what could be done. What are your thoughts
Yeah.
around it? And kind of so trial and error, not so much, but very much a conversation and just making sure that it fits for that individual.
And it sounds very collaborative, actually.
Yeah.
Yeah, with your clients to sort of figure out what would be in their best interest in the long run. So yeah, and so DBT sounds like it can be very helpful, like you said, combined with other trauma informed modalities to be able to help people navigate through their healing journey and just support them moving forward. Um, but also, in terms of your professional opinion, do you feel like those who've gone through childhood trauma should tell somebody, share it with somebody? Obviously, other than a therapist. But is it advisable?
Look, I think again, depending on the context and what that context is of that individual, especially a
Mm,
child, it becomes difficult because sometimes the people that are the ones that they trust or they feel that well not really trust, but the people that they have as support are the ones that are abusing them
yeah,
or causing that kind of trauma. And then it
yeah.
becomes quite difficult to have that conversation because who do I have the conversation with?
Mm,
But ultimately, yes, it is about reaching out, finding support,
yeah.
getting assistance, not kind of keeping it in and not allowing yourself to
Mm,
be shamed or to feel guilt or to feel like that person has done something wrong
yeah.
because they haven't done anything wrong. So
Mm.
yes, ideally, if they have access to it, or they can try get access to sharing it with a trusted person, someone that they feel will support them through that, whether it is to actually action something or even just
Mm,
to provide that support, I
mm,
think is important.
yeah, yeah.
Yeah.
Okay. And then, I like working with kids a lot. I have a very
Yeah.
sensitive and soft spot for kids. And I just think that it's really hard and very challenging and very disheartening when children go through these, different traumatic experiences, especially trauma caused by an adult. You
Mm.
know, and I know that's a huge topic on its own, and I'm hoping you'll come once again to be able to discuss that in detail. But I think in terms of the adults, I think I want to focus more on that. How can adults become more vigilant or aware of children who may have gone through childhood traumas? Like what maybe signs and symptoms they can become aware of? And I'm looking at it from a more systemic point of view in
Hmm.
terms of um, your churches, your schools, just these community programs maybe. How can one identify that a child may have been going through something? What can they look out for?
Again, I think that must be cautioned because I mean we don't want people to say, oh, because this teenager is now withdrawn,
Mm,
that maybe they've undergone trauma, because it's not necessarily the case either.
yeah,
So I think we need to hold that in mind.
yeah.
So but there are a couple of I think things that are noticeable and that you can notice the shift in somebody's demeanor. I think,
Mm,
especially in children or adolescents. So behaviorally, maybe you'd notice that they become quite withdrawn.
mm,
They're quite distant, no longer engaging with friends, with adults, just really keeping very much to themselves.
mm, mm,
Opposite as well, they maybe are acting out.
mm,
You might notice that they are expressing outbursts of anger, frustration, maybe inappropriate um, kind of responses to situations or events. Um, I think cognitively, you might notice that a decrease in the academic performance,
mm,
quite a significant decrease usually, not a gradual decline.
mm, mm,
Um, so it's uncharacteristic, if I can say that.
mm,
Um, concentration difficulties, daydreaming in class, loss of motivation, not
mm,
interested.
mm,
Emotionally, they might become more anxious, start exhibiting a lot more features of anxiety, possibly depression,
yeah,
again, anger. Um, so I think those are some of the things that maybe people can become aware of.
yeah. No, they are, and you know, I think, like you said a bit earlier, we can't just make assumptions that if a child is withdrawing, it means something
Mm,
big has happened. You have to find different ways to engage with that
absolutely.
child, and you know, maybe hopefully the primary caregivers is to find out if there's anything more. but one really has to be very careful and mindful on how they enter that territory so that you're not accusing people
Absolutely,
falsely.
yes.
I remember a teacher once confided in me, this was years ago, where she was the life orientation teacher, and they were talking about, sex and everything, and as part of the curriculum. And then about a week later, one of the students came and she actually shared one of her childhood traumas. Unfortunately, it was by her biological father. So it became such a huge case. But just that educational talk about sex led her to feel comfortable enough to go and share that this is what happened to me, and it was intervened, and she really got the help that she needed. And I'm hoping that she's in a much better space, psychologically. But I think it's so important to be able to create safe spaces for kids, not just intervene. I'm a big, I believe in early intervention. So I really believe that one should create a safe space for kids to be able to freely speak about what it is that they're going through, or at least prepare them. Unfortunately, we live in a very dark world. Just how can they sort of I don't know if I should use the word protect themselves because these are young children, but just to how can they deal with the situation there and then, or get out of it if they possibly can, or talk to somebody about it. So I think just for people to be mindful when a child's behavior changes or shifts, just to have a discussion with them, not to necessarily ask, are you being abused or have you gone through trauma, but just engage in them and just find out what may have been going on, who, what, where, and hopefully that could lead to a productive conversation.
Absolutely. And as you're speaking, I think, and I just realized that maybe earlier I didn't mention, then one of the traumas could be bullying as well. Absolutely. And
Yeah.
not just school bullying, home bullying, family bullying, whatever it is, but bullying is a big thing that also causes trauma. So I agree with you. Like, as we notice significant shifts in children, I think it becomes important not to have a directive approach, because I think that could be quite threatening for the child, but rather to express or to create some kind of supportive space, somewhere where they feel they can actually discuss what their experiences are, what they're currently feeling, what they're going through. So
yeah. No, thank you for sharing that. And now that we're coming towards the end, I would like you to share like words of encouragement for our listeners and viewers as to how can they approach trauma or deal with the trauma. What would you say to them?
Oh, it's such a long journey and it's a difficult one. And I don't think anybody takes away from the fact that it is a challenging process, and it is something that can be very difficult to access. But to encourage them to do so, because, like I said previously, as individuals, we are only a sum of our experiences. We understand ourselves and the world through what we've been through. And to understand that means that if we take a step back and reflect about our lives and who we are, and if we start to notice, you know what, I'm actually not happy with how I engage with relationships and with other people. I'm not happy with how I find that I regulate my emotions. I find that I'm actually being quite destructive in my behaviors. Maybe to take a step back and think, okay, this could be linked to something that I have been through before, that I haven't processed, that I haven't actually spent time understanding. And that's why I find it difficult to shift. So just to really think a little bit around that if we're looking to kind of grow, which we always should be in this world, to maybe take a step back and reflect about those things and to say, yes, it is challenging, but I think I read somewhere, we choose our heart, if I could say, and maybe it becomes important to take those steps to better understand ourselves, to make the shifts that we want in our lives.
Oh, beautifully put, Melina.
Thank you.
Thank you so much. We are the sum of our experiences, and we have, I guess, the opportunity to change some of those experiences, or at least work through those experiences so that we can become better versions of ourselves.
Absolutely.
Thank you for coming, Melina.
Thank you so much for having me. It's been wonderful.
Yes.
And I hope our viewers have enjoyed.